Namaskar. Welcome to my YouTube channel. Today we are going to solve Rrb Radiographer X-Ray Technician 2025 first shift question paper. Let's start. The first question. In an AP single hip radiograph, how is the central ray directed for optimal imaging? Option A. Perpendicular to the greater trochanter. Option B. 2.5 cm superior to the anterior superior iliac spine. Option C. 2.5 cm distal along the perpendicular bisector between the ascis and the symphysis pubis. Option D. Midway between the iliac crest and the ischium tuberosity. The correct option is option C. 2.5 cm distal along the perpendicular bisector between the ascis and the symphysis pubis. What is the purpose of the aluminum layer in a copper aluminum compounder filter? Option A. To absorb low energy scatter radiation from the patient. Option B. To enhance photoelectric effect in copper. Option C. To increase image contrast. Option D. To absorb the characteristic radiation produced by copper. The correct option is option D. To absorb the characteristic radiation produced by copper. Why is replenishment necessary in an automatic processor's developer tank? Option A. To prevent overheating of the solution. Option B. To improve image sharpness. Option C. To clean the rollers after each cycle. Option D. To restore consumed preservatives and developing agents. The correct option is option D. To restore consumed preservatives and developing agents. What is the primary purpose of bite wing radiography? Option A. To evaluate jaw fractures. Option B. To detect dental caries and assess restoration in premolar and molar teeth. Option C. To examine the root tips and anterior teeth. Option D. To access impacted wisdom teeth. The correct option is option B. To detect dental caries and assess restorations in premolar and molar teeth. What is the primary function of the emulsion layer in a photographic film? Option A. To capture and store the latent image using light or X-ray sensitive crystals. Option B. To protect the film from mechanical damage. Option C. To provide physical support to the film. Option D. To improve image sharpness through anti-scatter properties. The correct option is option A. To capture and store the latent image using light or X-ray sensitive crystals. What is the primary purpose of using sterile coverings on mobile fluoroscopy unit during invasive procedures? Option A. To prevent contamination and protect equipment and patient. Option B. To ease equipment handling during surgery. Option C. To reduce radiation dose. Option D. To improve image quality. The correct option is option A. To prevent contamination and protect equipment and patient. What is the primary benefit of using a balanced gradient system in balanced gradient echo sequence? Option A. Cause complete dephasing or flowing blood and CSF. Option B. Maintains phase coherent in moving spins, resulting in high signal intensity. Option C. Enhances T1 contrast by using longer TRS. Option D. Reduce scan time by skipping RF excitation. The correct option is option B. Maintains phase coherence in moving spin, resulting in high signal intensity. What type of X-ray tube movement is most commonly used in cranial radiography to reduce image blur? Option A. Stationary X-ray expose. Option B. Fixed anode rotation. Option C. Linear tomography. Option D. Spiral CT scanning. The correct option is option C. Linear tomography. Which of the following is the characteristic advantage of metal film hanger? Option A. They provide automatic digital scanning. Option B. They are only used for dental X-rays. Option C. They are durable and resistant to kerosene. Option D. They are disposable and lightweight. The correct option is option C. They are durable and resistant to kerosene. What is the Hill effect in X-ray production? Option A. Variation in X-ray beam intensity based on emission angle from the focal spot. Option B. Variation in beam energy due to patient thickness. Option C. Increase in X-ray intensity at the edge of the beam. Option D. Reduction in scatter radiation through collimation. The correct option is option A. Variation in X-ray beam intensity based on emission angle from the focal spot. What is the primary purpose of rinsing an X-ray film after development? Option A. To remove excess developer and prevent neutralization of fixer. Option B. To remove unexposed silver halide. Option C. To dry the film before fixing. Option D. To cool the film rapidly. The correct option is option A. To remove excess developer and prevent neutralization of fixer. Which of the following statements best explains why nuclei with an odd mass number are important in MRI? Option A. Their electrons are more easily removed, making them highly magnetic. Option B. They are heavier than even mass nuclei, producing stronger resonance. Option C. The imbalance between protons and neutrons gives the nucleus a net spin, enabling interaction with magnetic fields. Option D. They contains equal number of protons and neutrons while enhancing signal intensity. The correct option is option C. The imbalance between protons and neutrons gives the nucleus a net spin, enabling interaction with magnetic field. According to radiation protection guidelines for KUB radiography, when is corner shielding not applied for females? Option A. When imaging is done in a supine position. Option B. When using digital radiography. Option C. When the entire renal tract including the bladder must be visualized. Option D. When no stone are suspected. The correct option is option C. When the entire renal tract including the bladder must be visualized. Why is the posterior anterior PA projection preferred for relatively fit patient during lumbar spine imaging? Option A. It offers better visualization of disc spaces and sacroiliac joints. Option B. It allows faster image acquisition. Option C. It provides a more comfortable position for the patient. Option D. It eliminates magnification of the spine. The correct option is option A. It offers better visualization of disc space and sacroiliac joint. Why is copper always used in combination with aluminium in compound X-ray filters? Option A. To reduce filter thickness and absorb copper's characteristic radiation. Option B. Copper does not provide effective filtration. Option C. Copper is too expensive to use alone. Option D. Aluminum alone cannot attenuate X-rays. The correct option is option A. To reduce filter thickness and absorb copper characteristic radiation. Why is it important to position the pelvis so that the anterior superior iliac spine are equidistant from the image receptor in an AP-erect view? Option A. To prevent rotation and obtain a true AP image. Option B. To ensure both kidneys are included in the image. Option C. To reduce magnification of abdominal structures. Option D. To ensure the median sagittal plane is perpendicular to the detector. The correct option is option A. To prevent rotation and obtain a true AP image. Which positioning device is often used during cranial radiography to maintain head stability? Option A. Sandbags. Option B. Gonadal shield. Option C. Cervical collar. Option D. Skull clamp or head holder. The correct option is option D. Skull clamp or head holder. What is the monthly equivalent dose limit recommended by the NCRP for the embryo fetus after a pregnancy is declared? Option A. 0.5 millisievert. Option B. 10 millisievert, option C 5 millisievert, option D 1 millisievert. The correct option is option A 0.5 millisievert. What is the primary purpose of the X-ray beam alignment test? Option A to check the kilovoltage peak accuracy. Option B to verify that the X-ray beam is aligned perpendicular to the image receptor. Option C to measure exposure time. Option D to confirm the uniformity of the image receptor. The correct option is option B to verify that the X-ray beam is aligned perpendicular to the image receptor. Why are both open and closed mouth TMJ projections commonly taken? Option A to view nasal bone displacement. Option B to evaluate the anterior gliding movement of the mandibular condyle. Option C to access for sinus involvement. Option D to compare symmetry of the zygomatic arcs. The correct option is option B to evaluate the anterior gliding movement of the mandibular condyle. What does the transformer law state about the relationship between voltage and the number of turns in the coils? Option A. Voltage is equal in both primary and secondary coils regardless of turns. Option B. Voltage is inversely proportional to the number of the turns in both coils. Option C. Voltage is proportional to the number of turns in the coils. Option D. Voltage depends only on the current flowing through the primary coil. The correct option is option C. Voltage is proportional to the number of turns in the coils. What is the primary reason for coherent scattering to be considered unimportant in diagnostic imaging? Option A. It contributes less than 5% to total interaction and adds minimal image degradation. Option B. It occurs only with high energy radiation. Option C. It produces a large number of ion pairs. Option D. It significantly contributes to patient dose. The correct option is option A. It contributes less than 5% to total interaction and adds minimal image degradation. For an erect skull PA projection, where should the patient head be positioned in relation to the receptor? Option A. The forehead and nose should be in contact with the receptor. Option B. The chin should be raised to ensure proper alignment. Option C. The patient's head should be tilted 45 degrees toward the left side. Option D. The head should be tilted back so that the occipital region is centered. The correct option is option A. The forehead and nose should be in contact with the receptor. What happens to MRI signals in a vessel when flow velocity increases significantly? Option A. Flow appears brighter due to increased signal. Option B. Flow-related enhancement increases. Option C. There is no change in signal. Option D. High velocity signal loss occur. The correct option is option D. High velocity signal loss occur. What is the primary purpose of a film hanger in radiography? Option A. To scan the film for digital conversion. Option B. To store the X-ray films after development. Option C. To securely hold X-ray film during the manual processing. Option D. To expose the X-ray film to radiation. The correct option is option C. To securely hold X-ray film during the manual processing. In the lateral skull projection, where should the collimated horizontal X-ray beam be directed? Option A. Parallel to the medial sagittal plane. Option B. At a 45-degree angle to the patient's head. Option C. Parallel to the interpupillary line at right angle to the medial sagittal plane. Option D. Perpendicular to the floor of the cranial fossa. The correct option is option C. Parallel to the interpupillary line at right angles to the medial sagittal plane. What does the term pitch refer to in spiral or helical CT scanning? Option A. The number of detected rows in the scanner. Option B. The width of each CT slice. Option C. The angle at which the X-ray beam enters the patient. Option D, the ratio of table travel per rotation to the total collimated X-ray beam width. The correct option is option D, the ratio of table travel by rotation to the total collimated X-ray beam width. Which of the following components is part of the X-ray tube cathode and helps direct the electron beam toward the anode? Option A, collimator. Option B, glass envelope. Option C, focusing cup. Option D, target. The correct option is option C, focusing cup. Which component of the CT control console is primarily used to adjust image contrast? Option A, input keyboard. Option B, window with control. Option C, data storage drive. Option D, image touch interface. The correct option is option B, window with control. Which anatomical structures should be clearly visible in a correctly positioned axial calcaneum radiograph? Option A, subtalar joint and sustentaculum tali. Option B, tibial plaford and talar dome. Option C, first and second metatarsal. Option D, navicular and cuboid bone. The correct option is option A, subtalar joint and sustentaculum tali. What is the primary purpose of a circuit breaker in an X-ray machine? Option A, to regulate the exposure time. Option B, to protect the equipment and operator from electrical overload or fault. Option C, to reduce patient radiation dose. Option D, to enhance image resolution during exposure. The correct option is option B, to protect the equipment and operator from electrical overload or faults. What is the primary purpose of DICOM in medical imaging? Option A, to compress images for storage. Option B, to control the radiation dose used during imaging. Option C, to standardize the format and communication of medical images. Option D, to store X-ray film chemically. The correct option is option C, to standardize the format and communication of medical images. What is the thermionic emission in the context of X-ray tube operation? Option A, movement of electrons within the atom's nucleus. Option B, escape of electrons from a metal surface due to heat energy. Option C, emission of X-ray from the anode surface. Option D, production of radiation from interaction with photons. The correct option is option B, escape of electrons from a metal surface due to heat energy. What is the most important factor in the production of scattered radiation in radiology? Option A, X-ray tube voltage. Option B, field size. Option C, exposure time. Option D, film speed. The correct option is option B, field size. Which of the following best describes phase mismapping ghosting artifact in MRI? Option A signal dropout from improper coil placement. Option B, a distortion caused by metallic implants near the imaging area. Option C, a replication of moving anatomy along the phase encoding direction. Option D, a loss of signal due to flow-related enhancement. The correct option is option C, a replication of moving anatomy along the phase encoding direction. According to Rrb guidelines, what is the minimum required of any one side dimension for a CT scan room? Option A, 5 meters. Option B, 3 meters. Option C, 4 meters. Option D, 3.5 meters. The correct option is option C, 4 meters. Which of the following statements about coherent scattering is true? Option A, Rayleigh scattering involves interaction with a single electron. Option B, it includes Thomson and Rayleigh type and does not changes the wavelength of radiation. Option C, it involves energy transfer and ionization of the atom. Option D, it results in a change in both the direction and wavelength of the radiation. The correct option is option B, it includes Thomson and Rayleigh types and does not change the wavelength of radiation. What is the term for the amount of electromagnetic radiation absorbed per unit mass in a patient during an X-ray procedure? Option A, scattered dose. Option B, equivalent dose. Option C, effective dose. Option D, absorbed dose. The correct option is option D, absorbed dose. What is the role of fractionation in beam therapy? Option A, to divide the total radiation dose into multiple smaller doses over time. Option B, to target multiple tumors simultaneously. Option C, to increased beam penetration. Option D, to administer chemotherapy alongside radiation. The correct option is option A, to divide the total radiation dose into multiple smaller doses over time. Which of the following is a recommended technique to reduce attenuation type artifacts in ultrasound imaging? Option A, use a high frequency transducer. Option B, apply color Doppler to enhance shadowing. Option C, increase the gain to maximum. Option D, change the angle of the transducer to avoid dense structure. The correct option is option D, change the angle of the transducer to avoid dense structures. What is the key advantage of using a cylinder instead of a cone for X-ray beam restrictions? Option A, cylinders are easier to attach to the X-ray tube. Option B, cylinders are less expensive to manufacture. Option C, beam restrictions occur at the far end, reducing penumbra. Option D, cylinders allow for a wider range of field size. The correct option is option C, beam restrictions occurs at the far end, reducing penumbra. What is the purpose of the cleavage view CV in mammography? Option A, to access microcalcifications. Option B, to visualize the nipple in profile. Option C, to image the posterior medial tissue of both breasts. Option D, to evaluate axillary tail of breast tissue. The correct option is option C, to image the posterior medial tissue of both breasts. What is the main safety feature of a darkroom hopper used in radiography? Option A, it develops film instantly. Option B, it has two light-tight and X-ray proof doors that cannot be opened simultaneously. Option C, it operates automatically when a cassette is inserted. Option D, it uses high intensity light to clean cassette. The correct option is option B, it has two light-tight and X-ray proof doors that cannot be opened simultaneously. What does the atomic number Z of an atom represent? Option A, the number of neutrons in the atom. Option B, the number of protons in the nucleus. Option C, the number of electrons in the outer shell. Option D, the total number of protons and neutrons. The correct option is option B, the number of protons in the nucleus. Why is communication with accident and emergency staff important before beginning a radiographic examination? Option A, to reduce the number of radiograph needs. Option B, to determine the patient insurance details. Option C, to ensure the patient's condition and ability to cooperate. Option D, to confirm the hospital's imaging policy. The correct option is option C, to understand the patient's condition and ability to cooperate. What is the patient position in Waters view for maxillary sinus? Option A, side of the face touching in the image receptor. Option B, chin touching in image receptor with the orbitometer line at 45 degrees to the receptor. Option C, chin and nose touching the image receptor. Option D, forehead and nose touching the image receptor. The correct option is option B, chin touching the image receptor with the orbitometer line at 45 degrees to the receptor. Why should the central ray be directed for a standard dorsoplantar foot radiograph? Option A, at the base of the first metatarsal. Option B, at the calcaneus. Option C, over the cuboid navicular joint between the navicular tuberosity and tuberosity of the fifth metatarsal. Option D, just above the ankle joint. The correct option is option C, over the cuboid navicular joint between the navicular tuberosity and tuberosity of the fifth metatarsal. What is the main purpose of using lead rubber aprons and shielding during radiographic examination? Option A, to reduce radiation dose. Option B, to support patient posture. Option C, to increase exposure time. Option D, to enhance digital imaging contrast. The correct option is option A, to reduce radiation dose. What is the tolerance limit for tube leakage radiation during QA as per standard safety guidelines? Option A, 150 mR per hour. Option B, 10 mR per hour. Option C, 50 mR per hour. Option D, 100 mR per hour. The correct option is option D, 100 mR per hour. Which of the following is not a recommended characteristic of a darkroom floor in radiology? Option A, chemical resistant. Option B, non-slippery. Option C, porous and stain absorbent. Option D, durable and easy to maintain. The correct option is option C, porous and stain absorbent. Why should minimal exposure time less than 0.02 second be used in neonatal chest imaging? Option A, to improve visualization of ossification centers. Option B, to prevent motion artifact. Option C, to avoid overexposing soft tissues. Option D, to reduce radiation dose. The correct option is option B, to prevent motion artifact. Which of the following is a recommended body mechanic principle for radiologic technologist? Option A, bend at the waist when lifting objects. Option B, keep the load close to the body and lift with the leg. Option C, twist the spine to turn while holding a patient. Option D, keep feet together while lifting heavy equipment. The correct option is option B, keep the load close to the body and lift with the legs. How many degrees does each phase in a three-phase generator lag behind the previous one? Option A, 100 degree. Option B, 60 degree. Option C, 120 degree. Option D, 90 degree. The correct option is option C, 120 degree. What is the primary purpose of intelligent collimation during mobile SIAM imaging in theater? Option A, to increase image brightness. Option B, to eliminate the need from contrast agents. Option C, to speed up the surgery. Option D, to reduce scatter and improve image quality. The correct option is option D, to reduce scatter and improve image quality. What makes free radicals heavily reactive and capable of causing cellular damage? Option A, they contain paired electrons. Option B, they have unpaired electrons. Option C, they are large molecules. Option D, they carry a positive charge. The correct option is option B, they have unpaired electrons. Why is obtained consent important before performing a radiological procedure? Option A, it allows the technologist to avoid documentation. Option B, it speeds up the examination process. Option C, it is optional for non-invasive procedure. Option D, it ensures patient's autonomy and legal protection. The correct option is option D, it ensures patient autonomy and legal protection. What is a characteristic feature of acoustic enhancement artifact in ultrasound imaging? Option A, reflection of sound waves away from the transducer. Option B, enhanced visualization of deep tissue. Option C, increased echogenicity of structures distal to hypoechoic structure. Option D, long acoustic shadow cast by small structures near the transducer. The correct option is option C, increased echogenicity of structures distal to hypoechoic structure. In which MRI sequence is magnetic susceptibility artifact most prominently observed? Option A, inversion recovery. Option B, fast spin echo. Option C, gradient echo. Option D, spin echo. The correct option is option C, gradient echo. What is a common limitation of mobile X-ray unit compared to fixed radiographic system? Option A, greater maneuverability. Option B, limited tube current and power output. Option C, built-in PACS integration. Option D, higher image resolution. The correct option is option B, limited tube current and power output. Which of the following statements about CTPA, CT pulmonary angiography, is incorrect? Option A, it is a minimally invasive imaging technique. Option B, it offers high sensitivity for detecting pulmonary embolism. Option C, it is highly specific for diagnostic pulmonary embolism. Option D, it delivers a low radiation dose compared to other imaging modality. The correct option is option D, it delivers a low radiation dose compared to other imaging modality. Which feature in mobile X-ray unit enhance radiation safety for the operator? Option A, fixed exposure settings. Option B, long exposure cord or remote control. Option C, manual exposure control. Option D, built-in shielding for the patient. The correct option is option B, long exposure cord or remote control. In a scintillation detector, the role of the photomultiplier tube is to option A, focus the radiation beam. Option B, cool the detector during operation. Option C, convert light pulse into electrical signals. Option D, block high energy particles. The correct option is option C, convert light pulse into electrical signals. What limits the duration of continuous fluoroscopy when initiating exposure of an X-ray tube from a cold state? Option A, the voltage of the ceramic insulators. Option B, the energy of scattered radiation. Option C, the size of the focal spot. Option D, the anode's heat storage capacity. The correct option is option D, the anode's heat storage capacity. What is the main purpose of using effervescent powder during a double contrast barium shallow? Option A, to neutralize the barium. Option B, to create gas from esophageal distension. Option C, to thicken the barium. Option D, to reduce barium viscosity. The correct option is option B, to create gas for esophageal distension. What is the main role of the International Commission of Radiational Protection, ICRP? Option A, to provide recommendation for radiation protection and dose limit. Option B, to conduct radiological medical procedure. Option C, to manufacture radiation protection equipment. Option D, to enforce international radiation safety laws. The correct option is option A, to provide recommendations for radiation protection and dose limits. What is the primary advantage of flash CT scanning? Option A, it uses conventional X-ray film. Option B, it eliminates the need for intravenous contrast. Option C, it does not require patient positioning. Option D, it allows ultra-fast imaging and reduced radiation dose. The correct option is option D, it allows ultra-fast imaging with reduced radiation dose. Why is the half-valvular HVL used in fluoroscopy X-ray system? Option A, image contrast. Option B, collimation accuracy. Option C, beam penetration and total filtration. Option D, grid alignment. The correct option is option C, beam penetration and total filtration. Which plane divides the body into superior and inferior parts? Option A, medial sagittal plane. Option B, coronal plane. Option C, transverse axial plane. Option D, parasagittal plane. The correct option is option C, transverse axial plane. What is the optimal patient position for scanning the acquired tendon using ultrasound? Option A, prone with feet hanging off the edge of the bed. Option B, lateral decubitus. Option C, sitting upright with knees flexed. Option D, supine with leg extended. The correct option is option A, prone with feet hanging off the edge of the bed. Which of the following statements about isotopes is true? Option A, Isotopes have different number of protons and the same number of neutrons. Option B. All isotopes of an element have the same mass number. Option C. Isotopes have the same atomic number but different atomic masses. Option D. Isotopes have identical nuclear composition. The correct option is option C. Isotopes have the same atomic number but different atomic masses. Thank you for watching. Please like and subscribe.